Welcome to the segment of Tabitha, the counseling psychologist. And today I want to tackle the importance of family therapy when you have a loved one going through individual therapy. One may wonder, okay, why are we being involved as a family? Are we really part of the problem? At times someone may feel like, wow, I guess we're part of the problem, that's why the counselor is recommending. However, that may not be the case. Since you as a family are a support system, it's important for you to also come and understand and get what we call psychoeducation. Psychoeducation is an aspect where the counselor gets to give you an overview of what your loved one is going through. Remember, we say that counseling is confidential unless it's posing a harm to one person or the other person. That's when the counselor can breach the confidentiality. So during the family therapy, it's not me coming to share with you the exact details of what went on in the counseling session. No. But this is where the family comes to understand. And I'll use an example of maybe substance use disorder. You probably have been having a loved one who is suffering or going through the substance abuse, and you feel like they are struggling, hence they need help. And we refer to them as the identified patient. So you bring your identified patient to the counseling session, and actually they go through the sessions and they're able to understand, they're actually able to even stop the substance use. You do relapse prevention, you get to understand where the issue came from, you also dig deeper to the underlying issues, and you've been able to identify all those aspects. However, this individual will not be staying in counseling forever. Remember, they're going to come back to you. And for that particular example that I'm using of substance use, addiction is actually a family disease. And at times people feel like, why is our loved one not just stopping? We also drink or we use these substances, but nothing is happening to us. What's the difference? And that's where now family therapy comes in. And here the family will come. The counselor will actually able to educate you that one, addiction is a disease. Maybe you didn't know that. It can also be genetic, whereby one individual may be predisposed and they find themselves more prone to addiction than the other family members. Also, it's important for them to understand things like the stages of addiction, the role of the family even in helping them, what are their triggers, and also this gives this individual who has been going through counseling an opportunity to speak to the family. Because also some of these issues, people have been hurt along the way. And since they have been going through a process, the family probably could be stuck to where they brought the individual and they are not able to know how do we deal with this individual who has understood themselves, they're more self-aware, they know where they are going. And at times, if they don't go through the family therapy, you may find yourself always going back to what happened. So it's important for us to embrace family therapy. It's okay for you to ask the questions in case you've been called for family therapy and you're feeling a little bit not yet ready. You can always share your feelings, and you can also have a separate session first as a family before having now the joint session, because all of us have things going on within us. We may not understand what exactly it is, but talking it out really helps. So we also offer family therapy. At times we wonder, where do we begin? Just come, just book an appointment and we're going to know how we are going to go about it. So thank you very much for always reaching out, referring your loved ones to us, and I will link our office number down below. CareUp Consultancy. We're located at Kenyatta Drive, and we also offer virtual sessions. So thank you so much. Remember to reach out for your family. At times you don't have to have anything in particular that is bothering you. You can just come and have an opportunity to all of you share in a very safe environment. So I look forward to see you. Bye-bye.